Hello, everybody. My name is Reed Perkins. I'm the DFL endorsed candidate for Senate District 1, so the northwest corner of the state here. Yesterday was the announcement of the mask mandate for the state of Minnesota. I've seen some questions. I've heard both good information and bad information, so I just wanted to take a couple minutes to kind of clarify what the order is, what the order isn't, what some of the science is behind it, and then, like I said, to clarify some of those questions that I've already seen. So, as you probably heard, yesterday, Governor Walz in their press conference instituted a mask mandate for the state of Minnesota. What does that mean? On Saturday, Minnesota will join 30 other states plus the District of Columbia in having some variety of mask order. That order covers public indoor spaces and businesses, and it means you have to have some variety of mask, could be cloth, could be disposable, scarf, bandana, or religious covering. As long as it covers your mouth and nose, you're all set. There are, of course, exceptions. This is not a universal, every single person always has to wear a mask. Children under the age of 6 are not expected to wear a mask. And if you have health reasons to not wear a mask, or if it would be dangerous as part of your job to wear a mask, these are all exceptions. If you are out in public but you are eating or drinking, do not have to wear a mask. If you're in your own home, do not have to wear a mask. If you are in a private vehicle, do not have to wear a mask. So that if you're in an Uber or a Lyft or something like that, then yes, mask. But if you're just driving yourself, or even if you're just driving with your family, no mask needed. And then if you're at the gym, if you're doing cardio, if you're on the treadmill or the bike, no mask necessary there. But please have a mask with you, because then when you go back to the locker room, then you can cover again. This is not the line that Walz said several times yesterday was, we are not intending to be the mask police. And the goal here is to help everybody be in compliance, not to just punish people who are not. So businesses are going to be provided masks. At least one chamber of commerce in every single county in the state is going to have a delivery of masks. And so businesses in the area can then contact that chamber of commerce for some of those free masks. That way, if a person comes up to your business and they've forgotten their mask, you can just give them a mask, and then they can come in and shop, and we're all set. That way you don't have to turn away a customer. The only one I know up here right now is I know the Crookston Chamber of Commerce in Polk County is going to have one. But like I said, this is guaranteed to be at least one Chamber of Commerce in every single county. So the rural areas are covered there. And then police officers are also going to be provided masks. And police officers are going to try to hand you a mask before they're going to try to hand you a ticket. Again, the goal is not to be the mask police. The goal is to help everybody do this thing that we know protects each other and saves lives. To be clear, this should not be a partisan thing. As I said, there are 30 states plus DC that have a mask order. 8 of those states have a GOP governor. Alabama, Arkansas, Indiana, Ohio, Maryland, Massachusetts, Texas, and West Virginia all have mask orders. And there's no way that somebody can accuse something of being a Democrats-only force when Alabama and Texas are both voluntarily doing it. To zoom in a little bit, Texas, 80% in a poll released this last week, 80% of voters approve of Governor Greg Abbott's order requiring most people in Texas to wear a mask. 6 weeks ago, there were a lot of people in Minnesota asking Walz to act more like Governor Abbott. Well, 52% of voters say that looking back, Governor Abbott reopened the economy too quickly. Texas is putting a mask order in place now because they've seen that big spike in cases. Minnesota is starting to climb again, and so the goal is to have this mask mandate now to prevent us from looking like Texas. And we can look to Texas, who's now grateful that they have a mask mandate. We don't want to put ourselves in that same situation. An ounce of prevention is worth a pound of cure. We can prevent this from getting bad again in our state by having this mask mandate. And then additionally, we can look to some of the remarks President Trump has made. On Twitter, on July 20th, he said, "It is patriotic to wear a face mask when you can't socially distance." That tweet included a picture of Trump wearing a mask. In the White House coronavirus briefing on July 21st, we're asking everybody that when you are not able to socially distance, wear a mask, get a mask. Whether you like the mask or not, they have an impact. they'll have an effect, and we need everything we can get. So Trump is saying it. GOP governors are doing it. This should not be a partisan issue. Real quick to point out, you might see at the very bottom of the screen, I have links. This presentation is going to be public, so by all means, fact check me, look at my data. I want all of this to be as open and transparent as possible. So what does the science say behind it? Some of the research about why mask mandating saves lives, and then additionally, research saying that a mask mandate is the best thing for the economy right now. Right here is the University of Washington model. This orange line is if there's no national mask mandate. This blue line is if there is a national mask mandate. So starting today, if we had a mask mandate in place by October 1st, the estimate is that we would save 25,000 American lives. That's not counting the number of cases that additionally would be saved, but that's 25,000 deaths that are saved by a national mask mandate. We can look at some small instances. The infection rate in the largest hospital in Massachusetts, a state which, again, I will emphasize, has a Republican governor. They had an infection rate of 1.16 among all employees in the hospital. They instituted a mask mandate for all employees, and that included cloth masks in hospital settings. And they saw that infection rate drop from 1.16% down to less than 0.5%. And then as for the economy, if we look at the number of cases and lives that a mask mandate is expected to save, and we were to look at another lockdown that would have the same impact in terms of cases or lives, that would shave 5% or $1 trillion off the US GDP. By having a mask mandate, we are saving that. And that was research from Goldman Sachs and Forbes, not liberal think tanks. A mask mandate saves lives and helps keep our businesses on the right track to opening back up again. Some questions that I've seen. And again, ask questions. We are all learning new things. Things are changing rapidly. Asking questions is a good thing. So 3 that I've seen from voters that I'm talking to in the district. Why does this have to be a mandate? Why can't everybody just do it voluntarily? If masks are great, can we just open everything up now? And then why can't we let local counties decide what to do? So to answer those in order, why does this have to be a mandate? The research says that if you institute a mandate, it ups the percentage of masks being worn by 15 percentage points. When you have leadership saying, yep, this is the thing, we need to be doing this thing, more people do it. In terms of can we just open everything up now? Mask usage won't be 100%. And even if mask usage was 100%, mask usage doesn't stop 100% of COVID-19 spreading. So there are people who both will refuse to wear a mask for whatever reason, and there are people who can't wear masks for valid reasons. Our goal in Minnesota is to have a 95% compliance rate. That's less than 100%, so we're not going to have full coverage of masks. But like I said, there are other transmission routes for COVID. Yes, having a mask preventing spray is one of the most effective tools we have in our arsenal to fight this thing. But there are still other vectors of transmission. If it's on my hands and I can touch it from I can touch a surface that has it and then touch my food and eat that food and still get sick. So masks don't prevent 100% of spread. They're incredibly helpful, but it is not to the point where we could just absolutely open up everything up and just say if we've got masks, then we're fine. And then why can't we let local counties decide? So the virus does not care if you live in an urban setting or a rural setting. And the 2 counties in the state of Minnesota that have had the most cases per capita are Stearns County and Nobles County. That's not the heart of the metro. That's hours away from the metro. When it gets into a rural county, it also is more devastating because up here in northwest Minnesota, we just don't have the hospital space that the Twin Cities do. So we can't have the same caseload and expect people to be okay. And then we don't want to act retroactively. As I talked about with Texas, they're putting the mask mandate in now when they had spiked up to 10,000 or more cases per day. We don't want to let it get in our community and start to spread, because by the time we started to see hospitalizations rise, that's loss of life. Having this in place now, this preventative measure, even if our communities have not been hard hit, by COVID yet, having this mask mandate will ensure that they stay safe and that we remain on a track to be able to open up our businesses and have school open again in the fall for in-person classes. I want to close with one of the quotes that stuck with me from Governor Walz in their press conference yesterday. Masking will help protect our neighbors, keep our businesses open, and get us on track to return to the activities we love. Simple as can be. If you want our businesses to keep opening, we need to wear a mask. If you want our kids to have in-person classes, we need to wear a mask. If we want to protect our neighbors who might be vulnerable to this disease, we have to wear a mask. So, I hope this has answered some of the questions. I hope this has cleared some of the things up about what the mask mandate is, and then what some of the science is behind it, and hope some of those answers cleared some things up. Like I said, my name is Reed Perkins. I'm the DFL endorsed candidate for Senate District 1. This mask mandate is in no way the end of the discussion about COVID. On our website prior to this, we've written up policies about keeping Minnesotans healthy, keeping Minnesotan businesses open, and preventative measures to make certain nothing like this ever blindsides us again. We can be prepared. We should be prepared. We need to be taking those steps now. So, thank you again for spending a couple minutes with me today. Please wear your mask. Please wash your hands. Please socially distance if able. You're not alone. We're going to get through this. Thank you.